It is Ask the Expert, brought to you by Cumulus Media Allentown. We have got our friend Dr. Gerard Petersen here with the Lehigh Valley Health Network. He is a pulmonologist there, and we are talking about all sorts of things related to pulmonary fibrosis. So, Dr. Petersen, I'd like to thank you so much for joining us today, first and foremost. So I'm going to jump right in with the questions for you. What is idiopathic pulmonary fibrosis?
So, idiopathic pulmonary fibrosis is a chronic lung condition that typically develops with shortness of breath or cough and is progressive in nature. So, idiopathic means we don't exactly know what the cause is. And what pulmonary fibrosis refers to is progressive scarring of the lung tissue to a point that you have what we call restrictive lung disease, where your lungs are not as expandable as they should be. And as a consequence, you develop problems like shortness of breath, cough, potential need for oxygen therapy, and other medical problems and difficulties related to that development.
So I'll ask you this. So you mentioned obviously some of the symptoms are coughing and issues with your lungs. At what point, and especially, I guess this is a good question to ask now, in the midst of everything going on, where even a simple cough for anything, you don't know, you don't have a good idea of what may be going on with your body. What are some of the symptoms that you as a doctor would see or hear or know that me as a patient, I would have to go, okay, maybe this is something I should really try to look into here?
So certainly that's a great question. So typically when we talk about diseases, we differentiate between what we call acute, which means relatively new and sudden, or chronic, which typically means it's been present for around 3 months or so. So especially now with the coronavirus, we get worried about cough, but typically people who have cough related to either an acute bronchitis or pneumonia or a viral pneumonia, that's a short-term process for most individuals. So typically symptoms should be present for approximately 2 or 3 weeks, and then people will start to recover. When I'm talking about people who have chronic pulmonary fibrosis or other chronic lung conditions, those symptoms don't disappear. So 2 or 3 months later, they're still experiencing cough or shortness of breath. Those are typical symptoms that would necessitate being referred to either your internal medicine physician or family practitioner, and they might eventually send you to what we call a pulmonologist or a lung physician to further evaluate what's going on. So really, in this situation, it's the chronic, persistent symptoms that are worrisome for.
And so you're diagnosed, and what are some of the treatments as of today that people could expect if this is something that they're experiencing?
Right. So I would like just to touch base a little bit on the evaluation. So typically, when we do evaluate people for pulmonary fibrosis, we're doing a number of tests. So frequently, patients will first present to us with a chest X-ray. Sometimes we'll obtain something called a CAT scan, which is a fancier radiograph to look at the lungs in more detail. We perform pulmonary function tests, which will monitor the degree of lung function. We check oxygen levels, and we also do, as part of a routine evaluation, a physical exam, which can or cannot help us figure out if somebody has, or if we have a concern for somebody having pulmonary fibrosis. In the past, we used to do lung biopsies. Now, some of the qualities of the CAT scans and other findings are good enough that we don't always need to pursue lung biopsies, and then we could actually move right into treatment.
So if you're looking for support or education, Wesco Foundation for Pulmonary Fibrosis.org, and of course, the Pulmonary Fibrosis Foundation can help you kind of find everything you're looking for, right?
Yeah, those are absolutely great resources. I've been involved with the Wesco Foundation for Pulmonary Fibrosis for probably around 15 years now. It's a fantastic group, not only for education, but support, emotionally and socially, et cetera, and also a good resource for different treatment options, clinical research, clinical trials, and also helping to guide patients who and their families who will probably have a lot of questions in the early stages of their diagnosis.
So I want to go ahead and give that website one more time. It's Wesco Foundation for Pulmonary Fibrosis.org. He is Dr. Gerard Petersen of the Lehigh Valley Health Network. He's a pulmonologist there with a lot of terrific information. I know we certainly appreciate it, Doctor. Thank you so much for giving us some time on Ask the Expert this morning.
Excellent. Thank you very much for having me.